time of trouble, better carry slow. Statutes and commandments, what you gonna do? In time of trouble, what you gonna do? Yeah. What you gonna do? Yeah. What you gonna do? Yeah. In time of trouble, yeah. What you gonna do? Yeah. What now? What you gonna do? In time of trouble, trouble is near, yeah. You better prepare, yeah. Trouble is near, yeah. In time of trouble.
What does it entail? How to adequately prepare in the spirit and in the natural for Jacob's trouble? Some ways that Jacob's trouble may pop off, or things to consider during our times of preparation, whether it be a cyber attack, hyperinflation, famine, World War III, um, and some of the things that in the natural as well as the spirit. And the spirit, we covered the right mindset to have. We got to shed our sins and our fears and have faith in the Most High. We gave precepts concerning that, as well as in the natural precepts also. We talked about food storage, food rotation, self-defense, different types of skills for us that we should be learning, whether it's gardening, farming, um, child care, fire making, and things like that. So, and then within that, we broke off that series and did an analyzing Jacob's trouble, where we covered various TV shows and films, and extrapolated relevant lessons regarding those films that deal with end time scenarios or post-apocalyptic scenarios. So tonight we're going back to Jacob's trouble, our normal lesson. So this will be episode 14. This will be the intro to first aid and wound care. I believe we touched on this earlier, but it's always good to do a refresher and touch on some additional points. So again, this will be, the key word in this title is intro. So please don't think, oh yeah, I was in, that Jacob's Trouble class, 6 months ago, and they kind of cover first aid, and then yeah, I kind of know what to do. No, that's, like, this is just kind of like what we did with the intro to gardening. I gave like a broad overview of gardening, and then, you have to do your own research and training and things like that to, get the fullness out of the lesson. So this is definitely a active participation on the parts of the listener. So, for all these lessons, you have to be an active participant. So, so I'm gonna touch a lot of different points, talking about the kits and the just some different situations, the best way to treat them, and let's get started. So the first thing I want to cover regarding first aid is, of course, you want to have a kit. So a lot of things that people miss is a good first aid kit. Some people don't even realize it. Most people have bought that $30 kit that you bought at Walmart and you think you're covered. But that's not necessarily enough to prepare for emergencies by any means. By emergencies, I'm talking, Jacob's trouble, shit hits the fan type scenarios. Things in your, accidents in your house, cut finger, something like that is perfect. But you're talking, long, midterm, talking, a couple of months to long-term survival. You got to make your own kit. So, let's go ahead and, I guess, kind of delve into this. So the kit itself, you need something to use to put all your stuff in. So it needs to be something that you can organize the contents well. So a case or a bag with lots of dividers, small compartments is ideal. Many trauma kits come in a soft case, which is easier to take along with you, but it's hard to find a case like this that's large enough. So on Amazon, they have some kits you can, survival kits for like $29.99 or something like that. And for the most part, those are pretty good. You can add on to those or take some of the stuff out. So for instance, depending on the type of kit, I guess the bag itself, it really depends on how much weight you're willing to carry, and they have some really good ones that kind of fold out. So just type in first aid kits, first aid bags. There's some pretty good ones on Amazon. I'll post some links in the telechat of some good kits that I've bought, and it's pretty spacious. So but there's some things to consider within the kit itself. So the first thing is hygiene. So and again regarding first aid. So most wounds won't kill you directly, but the only way around a wound can kill directly is if a major organ is damaged. Typically, they kill. We're talking about wounds. We've seen that in a lot of shows. So people, getting infected by wounds and stuff like that. So hygiene is definitely a top priority to consider when you're, organizing your kit. So typically, the wounds they will kill by allowing the patient to bleed out or by infection. Bandaging is supposed to stop the bleeding, but if the wound isn't kept clean, the patient can die of infection. For this reason, it's extremely important to keep the wound and the surrounding area clean. That means keeping yourself from introducing any bacteria to the wound. So, you got to you've got to clean up on your own before treating the patient. This can also help protect you from any infectious diseases you might have. So, whoever would need that. Some things to consider. So the items you would need: antibacterial hand cleaner, that's everywhere now. Sterile gloves, medical mask, those are easy, and probably a CPR mask if that requires it. So, make sure you have that in your kit. So, with flesh wounds, alcohol, toilets, antibacterial ointment, butterfly closures, or steri strips. Now, this closing the wound. The steri strips, those are STERI strips, are really good. There's like if it's a deep cut or something, those can are used to close the wound where the skin is open or separated. So, you know, one thing that a lot of people are gonna, get infected. I mean, or die of. It will be, infections. So whether it's staph infection, tetanus, or coming from a cut or gunshot. So wound infections, keeping it clean and getting to that immediately, which we saw in The Oath, talking about Walking Dead. Paul was walking around with a cut for a couple of days, and then finally got infected, and that definitely put his wife in put them in a bad spot. So. When it comes to that, you want to treat that as soon as possible. So I played this short video regarding wounds, but I think it's good for this lesson as well. So this is a short video, short audio regarding wounds. Just 1 second. One second, let me get this up. Okay, so let's take a listen.
The cause of surgical wound infection. What causes wound infection? The cause of surgical wound infections is generally bacteria rather than other bugs, such as viruses. The skin is the first barrier of defence against infection. If during or after surgery harmful bacteria get into the wound, or if normal bacteria get mixed up with unhealthy or damaged tissue, the wound can become infected. Sometimes there may be some gaping of the wound incision, and this increases the risk of infection. Your body will respond to bacteria in a similar way as it helps itself to heal, with inflammation. Red and white blood cells will be brought to the area to fight off infection, so if you notice new or spreading heat, redness, pain or swelling around the area where the surgeon cut your skin, the wound may be showing signs of infection. These signs would usually occur after a number of days or even weeks after your surgery. Other signs of infection include pus, which is a thick green, yellow or brown liquid coming from the wound. It is very important to watch out for these signs and symptoms, as well as for high temperature or fever in the months after your operation. Please contact your GP or hospital immediately if you think your wound might be infected. Treating an infection early stops it from becoming worse or lasting longer than it should. If your doctor suspects you have an infection, take the antibiotics as advised. If you don't take antibiotics at the right time or complete the course of antibiotics, there is a risk that the bacteria will become stronger and harder to treat.
Okay. I'll post that. I think I posted that in the. I think I posted that in the back chat, but if not, I'll post it. I'll definitely post it. But I think I did. So when you talking about wound infection, I mean, again, prevention is the key. However, if someone doesn't tell you or they don't know, depending on the situation, and they think they cleaned it or they got it covered, then infection can happen. So one thing I talked about this, and I definitely suggest you guys doing your own research regarding this, is a antibiotic called amoxicillin. Now, I've seen some prepper videos regarding amoxicillin, and again, I'm not a doctor, so I'm not going to prescribe anything or tell you to treat anything using amoxicillin, but you need it. I think you need this by prescription. However, they sell amoxicillin for fish, which I have no idea how these fish take it, but they're the same size as human consumption. And so I saw a video where someone was saying from the pharmaceutical company, the I guess the website or whatever is called Fish Mox. So it's really amoxicillin. So they say in the factory, one, it's all the same pills, but one goes for human consumption and one goes to the pill, but it's coming from the same feed of pills. So, this is how some preppers are getting around I need to stock up on antibiotics or whatever. So whether you go this route and you want to throw it in your bug out bag, I mean, do your own research regarding that. But that is what I've seen and, researched regarding antibiotics. So in a situation like that where the wound does become infected, you need some antibiotics. You need some moxicillin, anything with psyllin. If you're in an emergency, you just got to grab something. Anything regarding, the antibiotics will help treat that wound. So, and a lot of things that go with that. So the most common ways people are going to get these type of infections or these type of injuries is accidents. Just being honest. Some people are liable to die from a, accidental cut than from a glorious gunfight with FEMA. It's just, a lot of us are going to get out of our comfort zones and, things, that happen to us every day. You're going to be out. Somebody might, I'm not saying you, but preferably, none of us, but someone, catches their finger on a rusted nail and keep moving like, oh, okay, it's fine. But yeah, it's fine in, this incubated system that we're in, and that you can go home and pour some alcohol on it or, get a tetanus shot and be fine. But, going 2 to 3 days without, proper nutrition, rest, and, treating that little nick can cause, some serious injuries. So I can't harp on that enough on, making sure your kit has everything you need to clean the wound, bandage the wound, and bandage again if it doesn't, if it gets, you have to change the bandages and treat it before it gets to infection and things happen, because at that point, you're really the person is really on borrowed time. So that's why I'm kind of like really harping on wound care. So, and within your kit, you should have, if it's a minor wound, in your kit, you should have everything, you need to treat that. So the sterile strips, the butterfly closures, that's going to close it up. Within that, you need to make sure you have some tweezers. Let me just kind of run off a list, and then, you can, add from that. 1 second. Okay. So Whatever kit you have, kind of make sure you got some of these things. Because I know some people, I've done it too. When I first started, I bought like a small kit from Walmart and just threw it in my closet. And then, looking at videos on first aid and CPR and this and that, and people are like, oh, do you have this? Or do you have that? And, that kind of forced me to, okay, this is a decent kit, but I need to make my own, trying to cover as many areas as I can while keeping this a pack, a pack that's, compact. Okay. So, have your adhesive bandages, your alcohol pads, your antiseptic solution, antibacterial soap. So, it's not a bad idea. It's not a bad idea. Excuse me, Salaki. It's not a bad idea to throw in a bar of dial soap, the antibacterial con, in your bug out bag. You can use it for washing and cleaning if you have to. Antibiotic ointment, that's your Neosporin. Antifungal, your battle dressings, your blood clotting, your burn gels, those butterfly bandages, compression bandages, cotton balls, pads, swabs, your CPR barriers, eye solution. Now, when I'm going through this list, you may think like, well, this is like 100 items. Well, again, it's a kit, so you might have one or two of the a little bit of everything, and some based on some of the kits are made, the way they're compact, you can fit all this in here. So it's not that bad. Um, you know, uh, your gloves, hand sanitizer, hydrocortisone cream, peroxide pads, the instant cold hot packs, medical tape, petroleum jelly, roll bandages, your scalpel, scissors. Now, for broken bones, you want to make sure you have something to create a splint. So those are your SAM splints, your elastic bandages, things like that. The foot wraps, medical scissors, tweezers, thermostats. If you want to throw a stethoscope in there, fine, go ahead. You might meet a doctor, or you may be a doctor. Cold packs, lidocaine, anti-inflammatory medicines. Now the thing, okay, so I'm glad this one has lidocaine. Now, if you have been, wanting to get some surgery done on your tooth, or something done, you probably want to do that now. If you're thinking about getting laser eye surgery, Salakia, you probably want to do that now. And even if you do have laser eye surgery, make sure you have your backup glasses just in case. So those type of surgeries, heaven forbid, we're out there and you got a toothache that's just, it needs to be extracted, and you have to extract it in under those circumstances. So again, time is, I say about the, talking about the righteous, those, the hopeful elect, time is on our side to get this stuff together, So, get those surgeries that you, need to get done, get those done now. So, and that's why, lidocaine, throw that in the pack. Yeah, you might want to do that. So, those are the basic, things that your kit should have. However, just like we talk about firearms, and just like we talk about your bug out bag with your food, and your little machete with your flint striker and all that, none of that matters if you do not have the skills to use them. So funny story, I did not know how to use a stethoscope. I did not know that you had to turn it, the little knob, to hear the heartbeat. So it's weird. I mean, yeah, I just didn't know that until I saw a video, and it's like, oh yeah. So it's a different type of hearing for whether the little dial that you put on the chest, you turn it a different way to give you just, it does different things. So with that, so one of the skills you definitely should learn is CPR. Tons of videos on YouTube to learn CPR. Those mouth to mouth, chest compressions, things like that. And that's why in your kit you might want to have a mouth guard, if you care about, catching a disease, if you're just, worried about, catching something from the person you're giving mouth to mouth, you might want to have that. If you don't care, then it's fine. But the skill of CPR is more valuable. So not only CPR, but CPR for not only CPR for adults is typically what we think about, is CPR for babies. Like, how do you do that? How do you turn over a baby to kind of tap, if she's choking, he or she is choking, to tap it back for a baby. It's going to be different for an adult, or a Heimlich maneuver is different, of course. So that's a skill that you should learn, that your kit will supplement. I mean, that kit will aid you. So the kit is not the solution. It does not compensate for a lack of skills. Okay, I mean, it just doesn't. So CPR is a skill. Um, you know, Plenty of YouTube videos out there, but we're going to get into some programs that'll teach you how to do that. So controlling bleeding. Brother Jake was talking about this last week. If someone gets a gunshot wound, or struck with an arrow, you pull it out and they're bleeding. How do you address that? They're bleeding profusely. How do you address that? Or they get stabbed with a knife or cut with the knife. How do you address that? So, um, you know, that's part of wound care. So you have to research on how to, deal specifically with a gunshot wound, and how to deal specifically with a knife wound, or you get struck with an arrow, for example. Now, wound care, like depending on the size and everything, and where it hit and all that, depends on the approach you will take. So your supplies will assist you. Um, your supplies will assist. Your kit will assist you in that, but making sure that you are staying calm and you're not panicking makes a big difference. And then going about methodically, cleaning it, bandaging it, stitching it up, using the steri strips. So the steri strips, if you don't know how to stitch, if you don't, you just don't want to learn that skill, or make sure you have some steri strips, because we don't know how what type of things that we're going to encounter, or people we may encounter that could use our knowledge. So those are very good for wound closures. But again, you have to know how to use them and how to specifically treat them. So there's tons of videos out there: how to treat a gunshot wound, how to treat a stab wound, things like that. How to apply a tourniquet. So someone's bleeding out, and you apply. And the only way to save them is to apply a tourniquet, and you can get them to a hospital. Um, so learning how to do that, you could also throw a little tourniquet kit in your first aid kit, and prayerfully you don't have to use it, but it's better to have it and not need it than to need it and not have it. But knowing how to do a tourniquet is a skill that you should that we all should learn. How to treat shock and prevent shock. So after a heart attack or any trauma to the body, the treatment for shock is used to prevent shock. So and with this, this goes into hypothermia. So I know some people. I mean, I don't know some people. During the winter time, catching hypothermia, especially if we have to be outside, could be a real thing. You know, so your clothing that you would wear for winter survival would be different from summer survival. Those are you put on your thermals underneath your clothes, your long johns, your winter socks, things like that, to prevent hypothermia. And of course, in the summertime, it's the opposite. To make sure you stay hydrated. So, um, how to prevent shock. So I just found this quick blog on this, so let me just read it. And but again, this is an intro. So for the can't stress this enough. This is not a end all be all. So um, yeah. So assume shock is present or will occur and treat for it after a heart attack or any trauma to the body. The treatment for shock is also used to prevent shock. You should not waste time looking for or waiting for symptoms unless you are a trained medical professional. So once again, assume the person has shock or will have it shortly and treat it. If the victim is conscious, keep them warm, raise their legs up to 16 inches to increase or improve blood flow to the brain, lungs, and heart. Do not raise the legs if you know or suspect bone fracture to the leg, or it hasn't been splintered, or if the victim has an abdominal injury or the bleeding from a head wound. To treat yourself, place your head lower than your feet by elevating your feet, or lay the head downhill if terrain permits. You use a tree, rolled sleeping bag, or backpack to elevate the feet. Loosen restrictive clothing. So this is definitely key if this happens during the wintertime and you have a bunch of layers on. You want to loosen restrictive clothing. If unconscious, turn sideways to prevent them from choking on their vomit or other fluids in the mouth. You want to control the body temperature, so this includes not letting them get overheated as well as not letting them get chilled. So again, this is please go into this. Now, to my attention, also when you learn CPR, it's also a good idea to get CPR certified. And that's where you get some you get hands-on training like that. So that might be something to look into. So the next skill is to suture wounds. That's we covered a little bit, but that is definitely a skill that we all should learn. To close them up. That again, infection. A lot of people are going to die from infection, especially I'm talking about here in America. So a lot of people are going to die from infection. A lot of people are going to die from dysentery, drinking bad water. People in third world countries could drink the water that would definitely make us sick. In the environment that we're in, but that's food poisoning, eating bad food, and dehydration because things that go with that. That's going to be a bulk of you say a bulk, I don't know. That's going to be a good amount of people dying than what versus what people traditionally think or Americans traditionally think is that you're going to be in a shootout with somebody. It's can happen, but this type of inconspicuous stuff is what's going to be taking a lot of people out. So learn how to suture wounds. Treating a broken limb, heaven forbid, you sprain an ankle, you break a leg, or you any type of broken limb, learning how to splint it and secure it until you can get more advanced medical care, or until it heals. Learning how to do that, and how to apply ice and things like that. That's something that we all have to learn. So with that, regarding those common, touch all skills, within the let me go ahead and cover this. This will make kind of just flows into it. So one of the ways to learn all these skills is called CERT training. So CERT, CERT, stands for Community Emergency Response Team. So it's a program that educates volunteers about disaster preparedness for the hazards that may impact their area, and trains them in basic disaster response skills, such as fire safety, light search and rescue team organization, and disaster medical operations. CERT offers a consistent nationwide approach to volunteer training and organization that professional responders can rely on during disaster situations, allowing them to focus on more complex tasks. Okay, so one way to find CERT so with CERT, look up, so for instance, I just went to this website, it says find your local CERT, and then, enter locations. I'm just typing in Houston, and then I click on that. And then it gives me a list of programs in my area for me to go to CERT. and the contact person, and click on view more details like that. So and this contact information, and they'll get you started. So this is I believe this is free. I don't think this costs anything. If you guys have any information on that, that'll be. But I believe this is free. So this is another, for those who say, and we did the survey a couple of months ago about the. Oh, King, there's something you wanted to add?
Yeah, a lot of times you could check in your area. A lot of the police departments, as well as fire departments, all emergency personnel, they'll put on CERT training in certain counties, and it'll be welcome for the public to come out and engage. They'll have training. They'll have like setups where you can perform different type of emergency training, just like what you're saying, things like that. I've participated in them while I was in law enforcement, while I wasn't. So yeah, you just got to check your local area, check with your police departments and fire departments, and they usually have it. At least I know in my county they have it like once a year. So yeah.
Con. Yeah. So in this, now you're breaking up on my end. Maybe my connection. Did it cost anything? The CERT training?
No, it was actually it was free. It was just given by all of the local law enforcement throughout the county. You just had to show up, and it was a free training. You also got like free T-shirts and different products and stuff.
Okay. So here.
Salakia, can I hop in there?
Yeah. Go ahead.
In college, actually, just because I can confirm what King Den is saying, one my major was physical education, and part of one of my classes, the final exam was actually getting your CPR and AED certification. And we actually went through the same process, and you didn't have to pay anything. So, just wanted to bring that out just to land me back off what he said.
Con. And see, there you go. So that is a set of skills that so regarding that survey we had about, why people aren't preparing, finances was a major part of it. So here is free training that you could take part in, that the skills that you could learn will be very valuable. That will be very valuable to yourself and to, people, in your group or camp or congregation that, didn't cost you anything, just had to show up. So, that eliminates, I guess that reason for, not preparing. So preparedness goes beyond, buying stuff. I mean, it goes beyond that. So even if you didn't buy one single item, the fact that you had CERT training and CPR certified, I mean, in terms of the, that you will be highly in demand. I don't know if that's a good thing or a bad thing, but that will be an in-demand skill. So, there was a survey that someone did, years ago about which professions will be the most in demand during, Jacob's trouble. Edomites call it shit hits the fan during that time. And, of course, medical doctors would be, were number one, I think, followed by, construction workers. I mean, carpenters, farmers, law enforcement, prostitutes were up there. I don't know how that got in the survey, but that was, that was a high profession that would be in demand during this time. But medical, without a doubt, was number one. So if you can just get this basic training that's free, it would, put you ahead of, people who have all these guns and, food and farms and all this stuff. And naturally, it'll, definitely put you ahead of all of them. So, you can buy the gear, you can buy the stuff, but you can't, buy the knowledge. So, hopefully that was helpful. Now, kind of want to touch on this a little bit. So we, last week we were talking about, we kind of touched on gardening. Someone asked a question about gardening. And, the question was, what do I do if I have a small apartment? How do I get around that? So, I talked about, using grow bags, and, if you have a patio, you can, grow some stuff out there. If you, if you want to do hydroponics, that can get kind of pricey because you got to buy the lights and all that stuff and the pumps. But one thing, if you have an apartment or not, you could start a small herb garden. So, you know, we talk about, herbs, but within this, first aid, things like that, a lot of, herbs can be grown and that will have medicinal uses. And I'm not talking about marijuana, but so let me just go ahead and get started with the list. Um, Basil. Basil. Most people don't think of basil as a healing herb, and yet traditionally it's been called the king of herbs. It's used medicinally as a natural anti-inflammatory, and it's thought to have mild antiseptic functions. Some healing uses for flagellants, lack of appetite, nausea, cuts, and scrapes. It also, you can also use it in, food, of course. Another one is chamomile. Its flower heads are commonly used for infusion teas and salves. This in turn can be used to treat indigestion, anxiety, skin inflammation, and as a tea, it can be used as a mild sedative to help with sleep. Feverfew. Feverfew. This is a perennial, is a member of the sunflower family, which has been used for centuries in European folk medicine as a remedy for headaches, arthritis, and fevers. The name feverfew comes from a Latin word meaning fever reducer. Its many uses include easing headache, pains, especially migraines. This is done by chewing on the leaves. A tea that is made from the leaves and flowers is said to relieve symptoms of arthritis. Next, you have lemon balm, which is a member of the mint family. It is considered a calming herb and has been used as far back as the Middle Ages, I'm sure longer, to reduce stress, anxiety, promote sleep, improve appetite, and eating discomfort from indigestion. You have parsley, which, of course, that can be used to take away bad breath, which, that's something we do have to consider. And I'm glad this thing talks about bad breath. If you're growing these, you get some plants from Home Depot or whatever. This is great, but however, which is more valuable, is the ability to identify similar plants and herbs like in the wild. Okay, so this parsley was talking about bad breath. So again, if we don't have a toothbrush, I'll post a video in the chat on how to make a toothbrush in the wild using pine trees. The needles, the pine needles, freshly picked pine needles that are still green. You can boil those, and it'll make boil until make a tea, and those are vitamin C. So there you go. You have a natural, free, immune booster of plenty of vitamin C from using. You can also take the branches and break them off, and then you can kind of like cut off the bark to reveal the inner bark. Um, and you can kind of bite on the edges and make a toothbrush. So those are ways to keep your breath fresh. If you can get access or identify parsley, wild parsley, and make a toothbrush. So I'll post that video on some guy doing it, making a toothbrush. But having this in your apartment, it won't take up too much space. You're not trying to grow a jungle unless you want to. But having these little herbs in this different pots and using that to make an herbal cabinet or whatever, or having a constant supply of tea and stuff like that is just as good as having a garden. I mean, someone who has a garden growing food. So don't some people get discouraged because, oh, I don't have that that 100-acre farm that I keep seeing on Instagram, which don't worry about that. Use the space that you have. Start with those herbs. learn how to cultivate them. And the good thing about these herbs are the lemon balm and stuff like that, basil. The more you cut them, the more they grow. So I mean, you can have almost an unlimited supply. Is like the more that cut them, the more they grow. They love being cut. So don't you learn how to cultivate them, then you'll have a almost a limited supply of that. So with parsley, you can make it as a tea, and it could supplement iron in a person's diet, particularly for those who are anemic. Drinking parsley tea can also boost energy and overall circulation to the body, which will help battle fatigue and lack of iron. Okay, so also I'm glad they mentioned iron. You might want to throw in your medical kit, or medical bag, or your bug out bag. You might want to throw in a bottle of what's that? Um, Multivitamins. There you go, multivitamins. Throw in a bottle of multivitamins, because that will also, I mean, nutrient deficiency. Some of us have bad diets anyway, but it's still, at least we can supplement that with a multivitamin, or the other supplements. But if you have to leave your house and you don't know when you're coming back, if you're coming back, having that multivitamin in your kit could definitely prove helpful. So um, now sage, um, sage comes from the genus name for sage is salva, which means to heal. In the first century Greek physician reported that sage stopped bleeding of wounds and cleaned ulcers and sores. He also recommended sage juice in warm water for hoarseness and cough. Now, again, this is a blog I researched, so whatever I read here, you want to do additional research, please don't just go off and, Brother Leo said sage, and then you get sick because you made it wrong, or you picked the wrong, whatever. So, again, this is just a keyword in this lesson is intro. Okay. Now, in sage, this is talking about a medicinal use. This is not talking about drying it out, wrapping it in some yarn and burning it to get rid of demons. I am not talking about that. I'm talking about for the medicinal use as a tea. It's in modern times is used to soothe mouth and throat and gum inflammations. This is because sage has excellent antibacterial and astringent properties. Okay. So, with all those, you have thyme, you have rosemary, you have peppermint, lavender. So, lavender, of course, that really smells good if you've ever, been around it, the actual plant, not air freshener or anything like that. But, making that from tea, it has a calming effect, for, they say mind and body. But yeah, with those herbs, also I want to add in honey. Okay, I know that's not a herb, but it's natural. And honey has two uses. So you can, well, three. You can add it to a sweetener as a sweetener. You can just eat it, as is, and that's food to give you energy and things like that. And you can use it as an antibacterial. Okay, so antibacterial. Um, you can, you heat it up and you apply it to a wound or a cut or something, and there you go. You got antibacterial. So honey, and it doesn't expire. I mean, it lasts forever. So there's no expiration date on honey. The only thing that will probably happen if you have some old honey and it gets, it just been sitting in the cabinet and just, somehow it's just gotten, too cold or too cool. It will, crystallize or harden. And with that, you just take the bottle, put it in some boiling water, the bottle, or and then it'll kind of melt away, and then you can use it or whatever. So those things like that, it's good. And so also with these herbs I went over, it's good to have an herb or anything, whether it's your any item in your kit that you can use for more than one purpose. Okay. So, your lavender, you can make it into a tea. Peppermint, you can make it into a tea. Some of these you can make it to a, tea and a solve. You can, grind it up and make it into a paste and then apply it. So the pine needles we talked about, you can take the needles, make them to vitamin C, and you can use the branches to make a toothbrush. So dual purposes, for more than one item is goes a long way. So for the identification, that's a skill in of itself that's related to first aid and wound care. Um, and a lot of these teas, they kind of like overlapped. Like some of them have calming effects, and they kind of lower anxiety, or they may be used for sleep. That in of itself would be helpful for some people during this time. So, I know we emphasize, oh, you got to get in the spirit, you got to have faith, and that's 100% true. However, none of us, I mean, I'm taking a quick scroll here, and if I'm wrong, please raise your hand and correct me. None of us have actually been in a combat, scenario where we actually heard bombs dropping and just artillery coming from all type of directions. We've never lived in, war-torn Afghanistan. We never lived in, Sierra Leone. We never lived in these places that, you're under constant stress of you don't know what the hell's going to happen next. We know, biblically, what the righteous is going to be. The righteous will not be forsaken, nor his seed begging bread. Um, so we quote that, we meditate on it, we go into lessons, we study that, we believe, but when that actually happens, you know you don't know. I mean, we just don't know. We hopeful that we will be able to remain calm as much as possible. We're hopeful that the people around us will be able to remain calm. So, if you're around someone who's panicking, like here, here's some chamomile tea, just take this and just relax. That's helpful. So, um, you know, it's we just don't know. So, we would like to believe, when the bombs drop, we were like, yes, um, but until it happens, you don't know how you're going to react to it. So these calming effects of natural herbs and plants and things like that is a good thing to have in your you could get some tea packs already and put that in your bug out bag. I have some. Those are not a bad idea. But knowing how to identify those plants in the wild, or if you're somewhere that you just happen to come across someone's farm and they got them, what lemon balm is, and if you just pick the plants or pick the leaves and smell them, you can kind of tell if those are good or not. Lemon balm smells just like lemons. It's crazy, but the the that skill of identifying and knowing how to use it is just as good as someone who has the farm and they know how to do all this stuff too. So um, let me see what else. Oh, Brother Makarov wants to come up.
All right, what? Okay, I'm late. I know. I just came from outside, but Mike hit me up, and I didn't know that you guys were on about class. Uh, Mike, is there something that I don't know? He said something about this class or whatever. So, excuse me if I'm coming in out of order, but I literally just got his text message.
Okay, well, no, we're just covering, first aid and wound care and the skills that are needed. So, we started like 7:15. So, um, you know, if it's something you
Oh,
want to the topic, feel free. If not, you just want to just listen in, it's all good.
okay. Oh, so you guys were listening in to something?
No, 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 no. I'm saying, I
Okay,
said,
all right. I
well,
mean, well, hell, I
No,
don't know.
my bad, Makarov. No. I was saying like going forward, like
Oh,
when I
yeah,
hit you
yeah,
up.
yeah,
Yeah,
yeah. I
about that.
got you. All
Got
right.
you.
Yeah, I got you. But yeah, regarding first aid, I mean, shit. Hell, I know a guy on IG. I'll put his. If you follow me, I'll just DM me if you want. If you really want his name, just DM me. I can't type it in offhand right now, but he's an actual EMT And yeah, just general knowledge. I would ask everyone to start learning CPR. And
Yeah,
in your emergency kit, keep some. Oh, fuck yeah, I know. All right, so what I have in my emergency kit, not everybody can afford like a top notch first aid kit. Just keeping it like real. A lot of times in World War II, World War One, even back in the old days, Civil War, even. I mean, of course, that's when disease was pretty high, so it's probably not the best example, but you get my point. People could substitute a lot of shit. Yeah, you can't always have a sterile gauze, maybe, because let's say you run out, then what? Are you just gonna be like, oh fuck it? No. Um, right. So if you're familiar with painting, go to Walmart, go to the paint department, yeah, and get this thing called Terry Claw. Right. It's like a pack of them, and they're about eight, maybe five, maybe $3, no more than 10. But it's like a shit ton of them. And what you can do, what I did, I washed them in warm water and bleach, and I let them air dry on a clean hanger. Um, or you can throw them in a jar or whatever. But that's just like a cheap. You can always keep some rags or something in your kit, people. That's what I do. Keep them in your car. Keep them in your kit because you can use them for wiping shit down. You can also use them if you honestly do tampons. Holy shit, tampons work. A lot of people have tampons in their first aid kit. Just whatever you can to stuff that wound after you clean it out or something. But yeah, just keep some rags, keep a knife and some scissors, and that's just like a bootleg first aid kit. So pretty much terry cloth. Yeah, they're white. Some scissors or a knife, and I would say like some duct tape and paracord. That's just a bootleg because you can cover up abrasions with that. You can fill wounds in with that, and you can also just wrap a wound with that. So that's all I got to say, Leo.
God, it's a lot. Um, I'm glad he brought up the tampons. Hygiene is, for women. Your your first aid kit will, all of us should have some form of hygiene kit. But for women, the feminine products will be something to consider in your bug out bag. So, make sure that you have that. And like Brother Makarov said, that could be also used in wound care if you're, just have a bootleg version. But everything we covered earlier, the steroid strips, the gauze pads, things like that, are all things that you should have in your kit. And not only that, knowing how to use them. So uh, in the chat, I'll post videos on I'll post a link to everything, all the videos I've collected in terms of first aid, that category. It's on the website as well. If you go to the videos on the website that we use for the movies, if you go to the website, there's a section called videos or how-to videos. You go on there, and then I have a section called first aid. So everything that we've covered today, um, uh, yes, how-to videos. So I have a whole playlist regarding first aid. So um, let me see right there. Water, winter survival. Okay, yeah, it's not there. So I'll make a playlist of first aid, and then I'll drop it in the telechat, and then we can cover pretty much everything that we've covered here. Some of the bags I've used, some of the books that some people use. So there's some books out there. I think it's called like Prepper's Guide to First Aid. I can drop that book in there. But for me personally, I know a lot of people that use books. For me, I'm a video person, so I have to see it and then be able to you know practically use it. So again, the guns and everything, the knives, and I know some people got bow and arrows and all that. That stuff is cool, but if you can't save a life, learning the skills of how to take a life, you have to be balanced. So I will definitely put a section on the website for first aid, and then load it up to the website and then send it to you guys. So, I mean, first aid as an intro lesson, there's not a whole lot to cover. Um, so that's why this lesson is not too long. Mike or King Ben or Azrael, is there something you guys want to add? I can bring up these people.
Yeah, Khan, just briefly. So for those that are in the telechat, I did put the cert link in there, so anybody that's interested in cert in the area, only thing you got to do is click on it. I believe it's Salakia. Let me go back to it. It's basically for anybody that's not in the telechat, it's basically if you go to cert, you type in cert, it'll come up. It's um basically find cert program, and it'll take you to certready .gov. And when you go in there, you'll see a place where you could type in actually, you could type in your zip code, and it'll link you to the ones that's in your area closest to you. And once you click on it, you should see something that comes up within your town or within the next town, and it'll say who's it being, sponsored by. Type, and that's just how mine had worked. It was basically in my neighborhood, and you can go. They'll tell you when it is. Unfortunately for us, it's usually like on a Saturday. That's the only unfortunate thing. It's usually on a weekend, or something like that. So, you just have to be mindful of that. It would, those type of things they can't hold them on, they won't hold them on the weekdays because that's when, everything is in. So they usually have it on like a Saturday or maybe a Sunday, according to the area. And, so I just wanted to, um, do that. I did have just a couple of precepts just in reference to, because basically this would fall under preparation, so we do need to be prepared. It's two that I had just in reference, Salakia. Of course, you can't. The normal classics that we always have is Ecclesiasticus or Sirach 38:4. The Lord hath created medicines out of the earth, and he that is wise will not have bored them. So, definitely we need to learn how to do these things, different type of things that, like Leo said, that we can use when we're out, certain type of natural, things in our environment that we could use to dress wounds. It's all type of things. If you look them up, just for that could possibly be in your yard. I found out, certain type of berries and things in my yard that's used for medicinal purposes. And, you can see, just how they are used online through YouTube and things like that. Can be used to dress wounds and stuff like that, but you just want to make sure before you do so. You don't want it to get infected. So, Brother Leo, brought that out, of course, through the spirit and a lot of information. Also, just in, what else did I want to bring out? And just with that one, a lot of us, we don't want to be so dependent on doctors and things like that. So we got to kind of prepare ourselves in that aspect, to be those type of guys that's out there that basically, we're gonna be on the site medical professionals, but not really in that aspect. But the more you learn, the better you'll be, because you don't want to be that person that just don't know what to do in those situations. You're going to probably be pushed in positions to be in leadership roles. So you want to be able to take care at least your household. So, my mother was always, you know, she was always nominated to be the doctor of the family. So, she is a forensic science biochemist, but she has a lot of first aid training and just know-how in a lot of different medicines and things like that. So I learned a lot from her. And I also took EMT training when I was in New York. So took a lot of training under that, and also with law enforcement. This is Ezekiel 38:7. It says, "Be thou prepared, and prepare for thyself thou, and all thy company that are assembled unto thee, and be thou a guard unto them." So, that goes along with, us using this preparedness, and those that are going to be along with us, our family, maybe company, friends, different brothers. We have to prepare in that aspect, in that leadership role, and, and take on these things. Like he said, these are training that you have to be, you know, actively doing. You should be practicing these things. My mom used to practice with me doing tourniquets and things like that just through her schooling. So we should be practicing. You could practice with, without, getting stuff ready and being able to use things, dressing. Prayerfully, you ain't got no cuts or anything you're dealing with, but practice of how you're bandaging is easy. Making casts, making splints, things like that. Last one, Salakia. This one, Luke 12:47. And that servant which knew his Lord will and prepared not himself, neither did according to his will, shall be beaten with many stripes. Right. And we know what that's in reference to, of course, talking about Yahushua, but it also goes in reference to us being, servants of the Lord and being prepared. And for this great tribulation that's coming, we need to be prepared, because there's a lot of people that are going to be beaten out in this wilderness with many stripes and with this tribulation. So we definitely need to be those servants that are preparing for, this coming tribulation every day, with everything that we're talking about. We on this app a lot, but we need to be taking this information and applying it. So yeah, that's all I really had, and I yield.
Khan, Mike or Azrael, anything you want to bring out a comment before we get to the guest?
My sentiments align with KB. We talk about it all the time. We have to absorb the information, and more important than that, you have to apply the information. So it's one thing to take heed, and it's one thing to apply the information that we're learning. And I think all of us together are learning new things daily as it relates to survival skills and everything else that we, consume mentally on this app. But we have to apply the knowledge. It's useless without application. Uh, so that I use.
Khan. Mike, anything? Brother Mike.
No, Khan, you can go ahead. They
Okay.
covered everything I was gonna say.
Khan. All right, moving along into the queue. Brother Chris, comments, questions, anything you want to bring out?
Yeah, Shalom Kings. And the water for, these classes and the website is a, mighty collection of resources. I must say, Brother Leo, it's definitely mighty. My question was, and Salaki, if y'all went over it, was about blisters, right? Because what have you seen as ways to, once you already have the blister, like kind of, help it heal correctly, in a environment where it's hard to keep it clean? Because I understand, like, the best prevention, reducing friction, keeping your feet dry, but it's going to happen, where you're out there, you're on your feet most of the time. And it's like, once that happens, that skin can, that, like you were talking about infection, like that could easily lead to, bigger problems. So I was just curious about that.
Yeesh, that's a good one. Yeah, that is definitely going to happen. You know, it, there's a the there's a few reasons that what, again, prevention is the cure. So let's kind of go over the causes of blisters. So you're talking about foot blisters, right? As we're trekking and all this stuff.
Come.
Okay, so let's go through, pull this up real quick. So if you have blisters on your feet, friction may be the culprit. Walking or standing for several hours a day puts pressure on heels, soles, and toes. The longer you're on your feet during the day, the greater risk for feet blisters. Of course, not everyone who walks or stands for long periods develops blisters. In many instances, these fluid-filled bubbles result from poorly fitted shoes. Shoes that fit too tightly or too loosely can rub against the skin. This causes friction, and as a result, fluid builds up underneath the upper layer of the skin. Excessive moisture or perspiration can also trigger these skin bubbles. This is common during warm seasons among athletes, particularly runners. Tiny blisters form when wet sweat clogs the pores in the feet. Feet blisters can also develop after a sunburn. Other possible causes are frostbite, allergic reaction, chemical exposure, typically from cosmetics or detergents, fungal infections, chicken pox, bacterial infections, herpes, and eczema. So, you know, kind of want to go into the, I guess, treatment. This is what I found. I'll drop the link, but I've never dealt with foot blisters, so I'm not all of a sudden an expert. So I can pretend I am. But that is definitely, I'm glad you brought that out because, we talk about these shoes, these, good hiking shoes and walking shoes. But if you haven't broke them in and, you're going to have to walk, in the Bible, when it talks about a day's journey, that's estimated about 20 miles. So, a person can travel 20 miles in a day's time. That includes, sleeping, eating, sun going down, stuff like that. So about 20 miles. So if you're traveling that a couple of days at a time, yeah, you're going to probably develop some blisters. And, from the things they said above, too tight shoes, too loosely shoes, excessive moisture in your socks. So that is why you want to have, part of prevention is you want to have some a couple of pairs of socks in your bug out bag. Okay. Change those socks out when you're, sit down for the night. Put on some dry socks, and the socks that you do have, wring them out if you can, and air dry them. But walking 3 or 4 days with the same socks and moisture is building up, yeah, you're going to get blisters and among other things. So, home treatment. You may be tempted to pick or burst a blister, but you should leave a blister intact because an open blister can become infected. Covering your blister with an adhesive bandage can help protect your blister while it heals. If you leave a blister alone, it may eventually harden and disappear. Until this happens, the bubble may be uncomfortable depending on its size. While you shouldn't burst a blister, safely draining the blister may provide relief. Here are some steps to properly drain a blister at home. Wash your hands with warm water and antibacterial soap. Use a cotton swab. Disinfect a needle with rubbing alcohol. Clean the blister with antiseptic. Take the needle and make a small puncture in the blister. Allow fluid to completely drain from the blister. Apply antibacterial ointment or cream to the blister. Cover the blister with a bandage or gauze. Clean and reapply antibacterial ointment daily. Keep the blister covered until it heals. Now, everything I just listed, the soap, the alcohol, the antiseptic, the needle, all of that should be in your bug out bag. So, if you have a decent medical or first aid kit, you should be able to treat a blister, just with the items we've covered today. So, and this link that I'm reading, I'll post it in the chat. So, because it's, seems pretty good, but I'll also post some tutorial videos as well. So, how to prevent a blister on feet. Preventing blisters on your feet involves addressing the underlying cause. If you develop a blister due to friction, wearing properly fitted shoes is the first line of defense. If your feet rub along a specific area of your toe, wearing an insole may provide extra padding and reduce friction. Shop for shoe insoles. If you're an athlete, make sure you keep your feet dry. Apply foot powder to reduce sweating, or wear moisture wicking socks designed for athletes. These socks dry faster and reduce moisture. If a cosmetic product, powder, lotion, or soap, or an allergen triggers blisters on your feet, avoid the irritant, reduces the likelihood of new blisters. For blisters caused by a medical condition, discuss possible treatment with your doctor. If you treat an underlying problem, you may lower your risk for blisters. So, possible cut it. ones are not going to cut it. Whatever high heels or Louis Vuitton or Prada, that is not going to cut it. You will have blisters, and you will not be able to walk. I've seen some movies where I forgot the name of this movie, but I'll post it. This guy, they get lost in the jungle, and he's lost for some days or weeks, and his feet are hurting. He takes off his shoes. The shoes are worn down. They're busted open, and he takes off his socks. The socks are all wet, and his foot are just blisters everywhere, blood everywhere, just because he was walking way longer than the hike called for. So it's a real possibility. I'm glad you brought that out. Thank you very much, Chris. That's very good. And something so common that we don't think about is something that could cause some very uh, trying problems for a lot of people. Thank you. Is there anything else, or did that answer your question?
Yeah, that answers my question, the water.
Okay, thank you. Thank you for that question. Malakawath, comment, question, anything to add on the topic? Malakawath? Okay, he might be on a call. Jake, anything you want to add? Comments, questions, concerns?
I'll be real quick. So excellent class. We should definitely do more of these. I hope this is recorded so that brothers and sisters can listen to this later. Um, so I believe it was mentioned earlier, but if not, so one of the things that you should get to start out with is easy. It's called an IFAK. It's spelled IFAK. IFAK kit. It's basically a small modular uh, first aid kit. It's military. It's very common in the military, active duty, police officers, et cetera, et cetera, et cetera. Open it up. Once you get it, comes home, open it up, look at what the things are in there. Identify what those things are and their uses, right? Don't just buy it and then put it in your backpack and then just think that you're going to just wing it when you go out there and all hell breaking loose. Learn what those tools are and what they're used for. Rearrange it and pack it to when it comes to things that are most valuable or you need to quickly access. Um, uh, Also, um, another thing that we have to take into consideration is a is the first CPR. I think that was mentioned too. That's important. Learning how to dress a wound, that's important because being able to dress a wound, and he mentioned it, being able to dress a wound, right? Even though you got hurt and you got a cut, if you don't know how to deal with that, you can start getting a fever. That could bring all kinds of added on symptoms to just a simple cut that you received and you didn't deal with it. Also, foot care. A lot of y'all have never walked a long time before. You might have gotten comfortable walking in a mall or walking at Disneyland, right? Where you were having fun and you had a comfortable sneaker, right? But in that day, when you might have to walk 10 miles a day or more for a long period of time, uphill and downhill, um, across riverbeds, across a river, um, carrying weight on your back, and maybe carrying children while having a fever, you need to be able to have excellent foot care because foot care could make or break you traveling from one place to another. I've seen, in the military, I've seen active duty soldiers or Marines in my case. The whole bottom of their foot, just the skin is just ready to be removed. It's just separated from their actual foot because they didn't put any moleskin or they just didn't have proper foot care. They didn't change their socks. They sweat all into their socks and that friction removed the skin. And now their skin is basically just flapping in the breeze as they're trying to cool their foot off. And they're not going to be able to walk on their feet for the next couple of weeks, right? putting them on bed rest or for a day or so, putting them on light duty simply because they didn't take care of their feet. You never really experienced something like that before, but in a high stress situation where you trying to find your next meal or you need to find some penicillin, right? Because you didn't have it in your IPAC and your wife has a fever and she coughing and you need to go to the Walgreens and see if they got one bottle of antibiotics left. Your feet get screwed up, that's not a good thing. So keep that in mind too. An IFAC and then making sure that you take care of your feet. Um, I don't think that I have anything else because this is a beginner's level intro, and the brothers did an excellent job bringing out some basic information. And by the way, sisters, this can be an office that you can definitely corner the market in our community, um, because we need we haven't even talking about if some of y'all are pregnant in that day. Woe to the women who give suck. We ain't talk about that, but you know, having an understanding of being able to take care of children in certain situations, or take care of pregnant women in certain situations, right? You can expand your office by just all around general medical care, right? You don't got to be a doctor and being able to diagnose cancer, but you can be a nurse, and nurses know how to diagnose. They see symptoms. They're accustomed to understanding what's going on. They just don't got that license certification. And if you fulfill that office, that's a very powerful office that you can fulfill in our community. You can be very useful in that day, because we're going to need you. Brothers should definitely know this, especially when it comes to self care. You get hurt, you need to take care of yourself. You should not be able to being like, I need to expect my brother to the left and right to me. That's what you learn in the military. You get shot in combat, you're not saying, somebody help me. You're not crying out for help. You're not doing that. You're doing self aid before you get buddy aid, and then long before you get medical evac. Helo evac may not even come until you take care of the area, right? You secure the area. Um, so you need to be able to, while bleeding out, treat your own wound, package the gauze, reach for your IFAC, take out the gauze, and be able to deal with it on your own. So brothers should know there's too many YouTube videos. Y'all gotten very useful, very comfortable with looking up, Sons of Thunder, Israelites, and Sakari, and ISUPK, and learning the scriptures. But you need to learn how to do, well, how do I make penicillin in that day? Right? In an extreme case, in an extreme situation. Or how do I repack my IFAC? What does this gauze do? What type of gauze automatically clots um, the area? And when I need to remove the gauze, how do I do it safely? How do I safely remove a bow and arrow so I don't strike an artery and then have this brother bleed out and then he dies, all because I didn't do it correctly? Um, how do I take care of my feet during a 12-mile hike? Um, Things like that. And also, your health starts now. Taking care of yourself now is how you begin to take care of yourself during that time, right? When it comes. If it comes 2 years from now or 10 years from now, and you're older and your bones hurt a little bit more. If you don't take care of yourself now, when that day comes, you can pray and have faith, but the Most High is going to be like, well, you're a fat ass. Why do I have to work extra hard to make sure that you survive when you had all the time in the world when things were easier? You could have took care of yourself. I'm, that is very important to understand the blessing that you have, not being able to live in that level of stress where you can prepare. Your body is that that portion that you need to take to be able to prepare yourself. So IFAC, foot care, um, CPR training, and being able to take care of yourself right now, your health and your fitness and your eating right, diet, exercise, drinking plenty of water. And I yield on that.
The water. I posted my picture, my PTR. I posted a picture of what Brother Jake was talking about. the little pack. I got one of these. They're, you know, Amazon has different types, depending on the size and the range and the price. So, you can and you can modify it with, other items that you already have, or, things that you've tested, outside of this pack. But I've also added, I'm also added some, everything that Jake talked about on the first aid section. I'm going to update this website. It'll be up, should be ready tomorrow with the updates and with these lessons and stuff of these tutorials. So, and I'm glad you said physical health, mental health also is something you got to take care of now. So, I mean, again, I don't know everyone's situation, but I can speak for me personally. Like, I used to have like a short fuse, and until I saw a video, some guy was talking about prepping and all this, and he was just saying, if you have a short fuse now, someone, cuts you off, and, you just start going off in your car. What makes you think you can handle the stress and um, the everything else going on with, shit hits the fan? And, that was, you know, that was helpful for me. It's like, yeah, if you can't handle, small things, how are you going to, handle, because to be honest, people are going to get sick, like Brother Jake said. People are going to get sick. People are going to get tired. People are going to be irritable. It's just, everything that we covered in the scriptures, in terms of being protected, but putting in our humanity. You're not having your 2,500 calories that you're used to. Um, you know, to say that people aren't going to get on each other's nerves, um, you know, it's not far fetched. So, having your mental health too, is also something that we can practice. And, our temperament, like Brother Dominique covered, um, definitely things that we could practice now, like something that normally just, causes us to go off, like, whatever, let it pass. So that is definitely important. And we covered that in the lesson, having the right mindset. Forgot what lesson that was. It's on King Ben's YouTube channel, and on the website. So having the right mindset is definitely something that we have to, you know, meditate on. So, Malakawath, you there, King? Okay, I think he hit it by accident, or he's away. Um, So I don't have anything else, but thank you, Jake, for that. I'll definitely put in those, and Brother Chris for mentioning foot blisters. I'm definitely adding that to the videos, tutorials, so that we can cover that as well. But I don't have anything else to cover, or anything to go over. Is there any other questions at this time or comments regarding this topic? Oh, and
Con, yes.
okay, go ahead. Yeah, I was calling you.
Yes, hold on real
Go,
quick.
oh, go ahead. Go ahead. You can go.
You said something about the mental health, and that was gonna be my question too, because sometimes I gotta, sometimes oh, I'm still every day, it's a battle. I kind of still deal with anxieties and stuff like that right there. So when it comes to trauma and things like that and PTSD, is it better just to handle that now?
I would say so. You want to start working on that now. So, the example that, um, I give, or we talk about, is like, brothers aren't going to have, brothers aren't going to have time to break down precepts, or, during this time, if we do, all praises. I'm just talking about like just anything. So people are like, we're telling people to memorize those Psalms, memorize Psalms 91 now, meditate it. So to sit there and say, oh, I'll do that when it's time, you may not have your Bible with you. You may not have the luxury and time to read Psalms 91. So, um, you know, take the time to, meditate on that now and memorize that now while we still have time. Because again, for the hopeful elect, time is on our side. We have time to, shed our sins, shed our weights. We have time to exercise. We have time to, make the proper investments to, secure, whether it's food or land or whatever. Time is on our side. So, once it starts, the Most High is going to add or take away whatever He sees fit. So, I'm just, I can only, I've dealt with anxiety real bad years ago. And that was going to the story that, I was talking to about, having a short fuse. And, it was the root of it was anxiety. I was, worried about Jacob's trouble. I was worried about, finances. There was a lot going on. So the thing that helped me in the spirit, I'm not trying to, diagnose or, prescribe anything, but just only talking for me. If it's helpful, all praises. For me, I just went on a really hard fast. It was like 21 days. And then, I did that a couple of times. And so that and just watching, I was I didn't know I was Israel yet, so I was watching some sermons from a pastor I did respect at the time, and based on my understanding of scriptures, he taught well. So fasting and really working on that, really getting in the Word, and really focusing on the scriptures that dealt with trusting in the Lord. So that helped me a lot. But I know for some people who have are prescribed medication, that's going to be a very difficult time when that is cut off. So, in terms of in terms of places that are going to get looted first, grocery stores and the pharmacies will be the first places to get looted, and doctors' offices and hospitals. So if if you can get off of that, and I was on it. I'm not gonna, I'm just sit here and be honest. I was on it. I was on antidepressants, and I just said I'm sick of taking this shit, and I got rid of it, and I said, Lord, I just don't want to. I shouldn't have to take this. I mean, I trust you are who you say you are. So, and then quitting cold turkey like that, it made it for there was a period when got really bad, but that fasting, it really helped. I definitely it helped a lot. So but for people who are not in this truth, who are not keeping the law, statutes, and commandments, those who are not even trying, those who are I'll deal with that later, they're gonna have a really hard time. Not saying the Lord is not gonna be faithful. I mean, like Brother Jake said, you're fat and out of shape. Why should I help you? The Lord may help you. He very may well help you. I'm not talking about you specifically, but that person, he very may help that overweight person who was slothful, but they're going to have a hard time that they should have, they're going to be regretting that they didn't take advantage of that time. So, yes, to answer your question directly, you want to do that now.
Okay, Con, appreciate that. Also, too, do you think we should stack up on guns as well?
Stack up on guns. That is a good question. You should have some personal protection. I'll put you like that. Personal protection, but stacking up on guns, no. You shouldn't stack up on guns. I don't fear the man who owns 1,000 guns. I fear the man who has one gun and has shot it 1,000 times. That's
Con.
I don't fear any man, but that's the the saying, how the saying goes. So if you have that one or two firearms that you've practiced with and you're comfortable with, and that's what you use, regardless of what your someone says, oh, you got a 9, you need a 40 or 45, whatever. As long as it's comfortable for you and you are trained with it and you know how to use it, that's all that matters. But you should have some personal protection. Yes.
And maybe
Yeah, I would say
Go ahead. Go ahead. Bring up guns,
no.
everybody
Go
wants.
go
I want to
No,
be
go
go
real
ahead.
ahead.
quick
Yeah, good.
Go ahead, Jake.
on the firearm survivability, blah blah blah. Right. I want to put this in y'all brains, right? And I think I'm gonna post something into the chat. Because do not, if you think that and I'm gonna talk to y'all like a man who's in the military and is kind of looks down on civilians. If you think that you're ready for Jacob's trouble with your firearm to actually go into combat with a person, you are gonna be mistaken. It will be a quick game over for you because you have no idea what Esau is doing right now with his firearms. Now, the people who I'm talking to who go to the range, they understand how to get a 3-point sling or a 2-point sling or a 1-point sling, and get their their plate carrier and get their setup, and they have their sidearm attached to their thigh, and and this, that, and the third, and they got their, the AR all set up, and they move targets and get out of their vehicles real quick. If they do that, I'm not talking to you. I'm talking to everyone that's got a firearm thinking that they can protect themselves during Jacob's trouble against an Edomite who is ready for you. They will game over you really quick, and that's just I, I'm going to put that in the chat to humble you, to understand the level of competency that you need to have with your firearm, whether it's a handgun or not. Um, it doesn't matter how many attachments you have, doesn't matter how many bullets you have or how many mags you have. If you are not proficient in being able to use that weapon, um, in a combat scenario, I'm not talking about I need to just protect myself or protect my home, but in a firefight with Edomites who wear Oakleys and ball caps with a flag on it. These people are trained to kill people really fast, and to change the mag and continue to kill people very fast. Um, they train to move in unison, to move like a unit, as if they're in the military and you are a military combatant. You're not an Israelite from the tribe of Judah. You are a militant combatant. You are the thing that they've been trained to hate. This Black Lives Matter, thing that they've been trained to hate, and they will quickly game over you. They will quickly kill you, especially if you're a sister by yourself. If they don't take you, they'll just shoot you because they want to live in that world. So be mindful of that. Also, what Leonardo was talking about mental health. Stress can definitely make you create a fog of war, right? There's something in the military we call fog of war, where things are happening all at once, and the anxiety of all those things happening all at once can create confusion. Um, your friend just got hurt, and now he's bleeding out and calling for his mama, while an ID or a rocket, a grenade just landed next to your Humvee, and now you can't barely hear quickly. You're just hearing a high pitched ring, right? And you're looking in your hands, and there's blood on your hands, but you don't know where the blood is coming from. That's called a fog of war in a military sense. But in a more practical sense, a survivability sense, fog of war could be your baby has a fever and you looking at your map and you going in the wrong direction, and your wife is now frustrated at you because you've been walking all this time and you going in the wrong direction, and she told you we need to go the other direction. And now that hostility and that anger and frustration that she has every right to feel in a high stress environment, and you are stressed as well because you need to worry about not only protecting her and providing for her, but also get health care for your child who is dying because of the fever. That could create a fog of war and a level of stress that y'all not ready for yet because you live in a very comfortable state. Um, how do you deal with that? You might have to deal with it by actually experiencing it, but also being training yourself in those situations, right? So you can have a command of knowledge that you can recall once that situation comes, can give you a greater edge on dealing with that level of mental stress that you're just not ready for yet. Keep that in mind. Um, because we can talk and you can sit in these classes, but these classes are not for imagining what Jacob's trouble will be like, but giving you the tools that you can prepare yourself now. And I yield on that.
I just want to speak on just the part of what the brother mentioned, because we do got a lot of I want to say Israelites that's running around that believe that the guns that we're going to be able to power our way through this trouble with guns and these things that we're able to obtain right now. um it goes back to that those that would live by the sword will die by it. And that's not to say don't get any guns, but that's not the that's not what will get us through. We have something way more powerful, and that's these law, statutes, and commandments in Yahweh Bashem Yahweh Shai, right? Faith, right? So we're gonna be using mainly that faith, and the weapons that we have, will be just accessories that that help us along the way, but it will not be something that would power us through. Like Jake said, these people are literally training their children from as early as they can walk to shoot at black targets like that are our people. So, even the best of our people with abilities is not going to outmatch our oppressors. They have literally been given the sword to oppress us. So we're not going to be saved through that action. It's not to say that you can't get a firearm, or I have a pistol and a long gun, which will probably, as I prepare, that will be the things that I take if I'm able to take it. You're not going to be carrying four guns on you, really. Pistol and a long gun, if you can have that, or which would be also if you can get bow and arrow, something like that, or crossbow. Those are silent weapons that we talked about. But you know the main thing about it is that make sure that you're, like you talked about earlier, your mental stability is there. That's very important for your leadership of your household and those that'll be around you. There's several sustaining scriptures that you may want to read. One that I find is very pleasing to me and comforting is Second Corinthians, Salakia, Second Corinthians 1, and I would read all the way down to Second Corinthians 1, and I would read down from 1 down to 7. 7 is from Second Corinthians 1, chapter 1, and verse 1 down to 7. It's a very comforting precept. There's several more, but you want to make sure that you are in the right mindset. Leo also said he did a actual Jacob's Trouble class on that, and that would be I believe that was episode 8. I want to say it's Jacob's Trouble episode 8. If you go to the YouTube, it's actually it's on the playlist, and it says the right mindset and the right places. So it's good to check that out, just of the way you want to be in that, when you are in that position, the things that you would be thinking, and that preparing yourself for those tough situations. So that's something to go look at. Also, it's one thing I did want to also say in reference to, I did want to say, bear with me. I can't. I think I lost it, but it was basically in reference to, our weapons are not carnal. You know, the weapons that we have is weapons that you know will basically get us through, these guns and these things that, no, they're not. I've done a lot of training. I have a lot of weapons, and a lot of times you may not even be home. You may have only thing what's in your car with you. So we pray in that day that the weapons that we have been praying for, this faith, and this understanding that we have gained, that's the most powerful weapon that we have. So just prepare yourself, King, and prepare your household. That's that spiritual weapon that we got in this time. So I hope that helps, King. The brothers added a lot. So I hope you take those things and prepare your household and yourself for that time.
The name of the YouTube channel, what's the name of it?
It's right in my bio. So if you go in my bio, you see the YouTube channel, and you could just copy that link, and it'll take you right to there. And it's a playlist. All the playlists is on the YouTube, Jacob's Trouble, and you could go through listen. It's like I think it's the episode number 8, the right mindset in the right place.
Okay, count the water.
Let me see. I
And
am the
one thing I do want to add when we're talking about, I guess, the mental health, whatnot. If you pray to the Most High to like strengthen your patience, I mean, get prepared to go through quite a few situations that will test your patience, because that's the only way you're going to grow. It's not going to just give you, the power of patience. Like, they have this thing called exposure therapy. So, exposure therapy is directly facing a feared object, situation, or activity in real life. For example, someone with a fear of snakes might be instructed to handle a snake, or someone with social anxiety might be instructed to give a speech in front of an audience. So that type of therapy, people who say, Lord, give me patience, and he says, okay, and then you're gonna have a bunch of situations that are going to try your patience. And it's not gonna be like, oh, no, 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 I didn't mean to pray for that. Well, you gotta go through it now. You're already holding the snake, you're already giving your speech. Go through it. So that type of situation, if you just, if you're that bold enough to pray for it, or he knows what you need and he's gonna give it to you anyway. So, but having that type of maturity to say, Lord, this is where I'm lacking. Help me in this area. With prayer and fasting, the Lord is faithful. So there's, my anxiety is, it's a it's a mere shadow than what it was. So some things that annoy me now is people butchering the Bible and stuff like that. But the stuff that I had to go through to get strengthened in that area was all praises to the Father. I mean, I definitely give him glory for that. So I mean, I've been there. I definitely can sympathize and empathize with you. But I highly suggest meditate on that lesson that Brother Ben was talking about. Meditate on the scriptures, and if you haven't fasted, I would highly recommend that. So,
and if I can just say, if you go into the book of Chronicles, namely, I was First Chronicles 29, and start read from basically 29, 18 and 19. David actually prayed for faith. So, you can pray for faith in that time. You can pray for for patience. You can pray for these things. And the Most High, if you are sincere, he will give them to you. He literally prayed for his, his not only himself, but for his people. He prayed for his son, so you can literally do these things. So I just want to say that. And it's in the book of Chronicles, that was I believe 29 and 18. 29, First Chronicles 29, 18 to 19.
Okay,
So
Con. This is my last question before I go to bed. Are we already inside Jacob's trouble?
um,
I would say, I mean, a lot of people would say that, but I say we're moving into it. We're at the big, really at the, I would say, coming out of, because we go in the book of Revelation, we basically leaving out of the fourth seal into the fifth seal. So that speaks about Jacob's trouble. So we're moving into it. We're definitely, you know, uh basically on the precipice of Jacob's trouble, I would
Okay,
say.
okay. The reason why I asked because I came past somebody and they said we already inside Jacob's trouble is because our brothers and sisters inside the Caribbean and South America, they going through things that's like Jacob's trouble that we're gonna face out here, and I kind of think that's why some brothers believe that.
Well, I mean, that's when you get into, like, that's kind of doctrinal. So, have they started pulling our people out of houses and killing us because we're Israelites yet? No. So it's according to where you have understanding on that, because it literally talks about them pulling us out of our houses and killing us, killing, if you go into Second Esdras 15 and also 16, for those that fear the Lord. So have we done that yet? No, but it's according to you see our people are dying every day. Some people believe that we had Jacob's trouble since we landed here in the United States. So they believe that that's the trouble we've been in. But it's according to where you fall in that understanding. I'm more inclined to believe, with the scriptures of, when we get to that time, it'll be like no other. So we still kind of like walking in the cool of the day, which is, we're still, we still have, we're able to sit in our homes and sit on Clubhouse. So,
Count
you
the
know,
water for that, because that's what I'm leaning at too.
Con. Well, I don't have anything else to cover. If there's any more questions, feel free to raise your hand. We'll bring you up. If not, Brother Ben can close us out.
Y'all have a good night.
Good night.
Shalom.
I end up our king. You have a good one. Yeah, definitely powerful lesson. Thank Brother Leo and everybody that contributed, all the brothers that came to the stage, and the questions. I think we put everything, some stuff in the back, in the telechat for anybody that is not in the telechat. Just contact myself, Brother Leo, Brother Azriel, Brother Mike, and we'll get you in the telechat. So, of course, we want to give all honor and glory to Yahweh Ba'ashem Yahweh Shai, for thanking for allowing us to come before you, and Brother Leo putting this beautiful lesson together. We pray that y'all have a beautiful rest of your night. And with that being said, we'll say Shalom.
Shalom.